Good morning, everyone, and welcome to Mile High Living. I'm Gina Bellich. Over 10 years ago, the first family-owned and operated American Vein and Vascular Clinic opened in Pueblo, Colorado. And since then, they have opened 8 additional facilities in our state. They are a world-class network of vein and arterial diagnosis and treatment centers helping those in need. Founder Dr. Gordon Gibbs is here with us today to tell us a little bit about the American Vein Clinic and how it got started. Thanks for being here.
Good morning. Thank you.
So 8 or 9 now.
We have 9 locations now.
We're going to get to that here in just a second. Congratulations.
Thank
How'd
you.
y'all get started?
So we started back a little bit more than a decade ago now, down in southern Colorado, and it was really born out of the idea that we had some new treatments to address problems with people's veins in their legs. They were quite a bit less invasive and more effective than what had been done previously, which for the most part was hospital-based stuff that would be more like vein stripping. Mm-hmm. And so with less pain, with more accuracy, with better outcomes, really a lot more people get their veins treated than they did in the remote past. And so we really expect people to get a great outcome now.
When it comes to vein disease, are there some common symptoms that maybe people have but don't realize they have or should look for?
Yeah. So some of the more common things that people come in with are just achy, heavy, tired legs. My legs just feel bad towards the end of the day. They're just tired and they hurt. Sometimes people have nighttime symptoms with cramping and restlessness, and that can be really debilitating because they can't fall asleep because their legs just want to move on their own, or they can't fall asleep because of cramping. And then their sleep cycle is disrupted. They can't, get a good rest so that they're functional the next day. And then also the daytime symptoms can be equally as bad because at the end of the day you just feel really tired. You're not able to do what you want to do during the day as a result of those vein problems. And we have treatments that are very effective now and can address a lot of those.
So what are some causes then of vein disease?
Yeah, it's mostly genetic, frankly.
Okay.
So if mom or dad has it, you're more likely to get it. But it's definitely influenced by your lifestyle. So if somebody is really heavy or sedentary, then they're much more likely to have some problems. If they're active and they have really strong legs, particularly the calf muscles, that can be preventative to a certain degree and really minimize the symptoms that they have. But fundamentally, it's genetic.
All right, blame mom and dad
there you
for
go.
it if you've got it right. So what kind of exam then is needed to see if this is something you've got?
Yeah, so fortunately you can see it a lot of times just with your own eyes. And so if you have varicose veins, for example, that's a sign of underlying venous disease. If you have swelling, if you have skin discoloration, a lot of that is just something you can see with your own eyes. So a lot of times people will come in and they have already self-diagnosed, hey, I got this problem. But really what we do is we use an ultrasound machine. So an ultrasound machine really allows us to get a good look at the blood vessels themselves, look at the dynamics of the blood flow going through those blood vessels, and we can really confidently say, these are abnormal, these are normal, these are the ones that we want to treat, and can come up with a treatment plan that's going to be very effective.
So when you go to someone comes in and says, I think maybe this is what I've got, or here are some of my symptoms, basically the ultrasound then is the test you use, correct?
The ultrasound creates the roadmap of exactly what it looks like in each individual patient. So it's different on just about everybody. There are some commonalities that we really look for, but the ultrasound is really very helpful in helping us come up with an effective, customized treatment plan for everybody.
Sounds good. What about, and when people come in and have something like this treated, they might be worried about the expense of it all. Does insurance pay for something like this?
Yeah, I guess that's one of the really good things about what we do is that insurance generally does cover it. So if somebody has symptoms related to their veins that influence their quality of life or influence their ability to do their job, then generally it's going to be covered by insurance. And that includes Medicare, that includes Medicaid, and most commercial insurances we accept at our locations.
Oh, that's good to know. So this isn't something you should have to sit at home and worry about and think, I can't get this taken care of if that's the case. All right, we started this whole segment off talking about a new location. Talk about that.
Yeah, so we have a brand new location in Thornton, Colorado. So we're very excited about that to try and expand our reach into that part of the Denver metro. Brand new clinic. It's really right across the west side of the freeway from North Suburban Medical Center. So it's really a beautiful location and excited to see people there.
So we've got Thornton, let's say up here north of just the Denver metro. Where are the rest of your locations?
Yeah, so we really have much of the Front Range available now. So Fort Collins, Thornton, Parker, Highlands Ranch. We have 2 in Colorado Springs. So we have 1 up in Edwards in the Vail Valley, and then down in Pueblo and Canyon City as well.
You really are kind of just taking all points around the metro area, north, south, and west as well.
Trying to, yeah. So to me, a lot of this is based on convenience. So if we can take an effective treatment plan and make it convenient for people, I feel like when we're doing a better job serving them than requiring somebody to go into the hospital. And it just is a little bit more of a lengthy process when you do that.
Now, before we go, could you just recap again some of the causes, or maybe some of the symptoms, rather, I should say, that people might be experiencing if they have something like this?
You bet, you bet. So really one of the things that we're commonly looking for is something called venous reflux. And so that's a problem that occurs with the valves on the inside of the veins not functioning correctly. And those little check valves become leaky and blood gets pulled in the wrong direction. So gravity will pull the blood and it pools down at your lower legs and feet. And that causes heaviness, it causes aching, pain, cramping, restlessness. It causes, with time and pressure, those veins become bigger, so varicose veins.
Yep. And
all of those fall into the same, yes.
All right, Dr. Gibbs, we appreciate you being here.
Thank you, Gina.
All right, take back your legs. American Vein and Vascular Institute offers minimally invasive in-office treatment options for venous disease. Call their number today at 8445-MY-LEGS. That's 844-569-5347, or visit them at AmericanVein.com for more information. They paid for today's segment, and we'll be right back.